Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In this episode, we're going to be discussing a medication known as Nitrofurantoin. Its brand name is MacroBid. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find the information to be valuable, please consider leaving a like on the video, as it would really help me with the YouTube algorithm. So first, what will we cover in this presentation? We're going to start by talking about how MacroBid works. We'll discuss indications or reasons we would prescribe this medication to a patient, then contraindications or reasons we would not be able to prescribe MacroBid, followed by examples of dosing, and then stick around to the end where we'll talk about side effects. So how does MacroBid work? So it's reduced by bacterial flavoproteins to reactive intermediates. These intermediates inactivate or alter bacterial ribosomal proteins and other macromolecules. This causes the inhibition of vital biochemical processes and the synthesis of bacterial DNA, RNA, cell wall, and proteins. In terms of indications or reasons we would prescribe this medication to a patient, we often see it prescribed in urinary tract infectious diseases, or UTIs. It can also be used prophylactically to prevent a UTI. In terms of contraindications or reasons we would not be able to prescribe MacroBid, we wouldn't be able to give it to a patient who had a hypersensitivity to nitrofurantoin. If a patient had anuria, which is the failure of kidneys to produce urine, they would also not be able to use this medication. It's not given to patients with significant renal impairment or in pregnant patients during labor and delivery. It's also not given to infants under 1 month of age. In terms of dosing with MacroBid, when used in a urinary tract infectious disease setting, it would be 50 milligrams to 100 milligrams orally 4 times daily for 1 week. If a patient was using this medication prophylactically or preventatively for a UTI, then they would use 50 to 100 milligrams orally each night. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using MacroBid, so I'll discuss some of those here now. Some patients may experience nausea, while others may experience vomiting. Flatulence is a possibility with MacroBid, and some patients may notice a change in color of their urine. The more serious but rare side effects would be lung diseases, liver problems, or a feeling of numbness or tingling. That's all we're going to talk about today with Nitrofurantoin or MacroBid. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.